May 8th is celebrated as the World Thalassemia Day to commemorate those number of lives who have been lost due to thalassemia and to encourage those people who are living and struggling with the disease. Hi, I'm Dr. Sheetal Dayal. I'm a practicing gynecologist in Italsi, Narmadapuram. Today we'll talk a bit about to understand the disease called thalassemia. Thalassemia is an inherited blood disorder which is caused when the blood doesn't make enough of protein called hemoglobin. Hemoglobin has a heme component and a globin component. The globin component has an alpha component and a beta component. The disease thalassemia results in defective globin synthesis and hence not enough hemoglobin. When there isn't enough hemoglobin, the body's RBCs, red blood cells, don't function properly and they last for a shorter period of time. RBCs carry oxygen to all cells. When the oxygen carrying cells are less, the oxygen received by the cells to carry out any cellular function is also decreased. Hence, the person may feel tired, weak, fatigued, short of breath, which we call anemia. People with thalassemia may have varying degrees of anemia depending upon the type and variety of thalassemia they have. So let's understand what are the types of thalassemia. Thalassemia are of two types. You have alpha thalassemia or beta thalassemia. In alpha thalassemia, there is a decreased number of alpha globins, and beta thalassemia, there is a decrease in beta globin synthesis. Thalassemia can be divided into trait, minor, intermediate or major, depending upon the inheritance of one or more trait from one or more parents. The most severe form is thalassemia major, where the child receives inheritance from both parents, who themselves are either minor or trait. Now let's see, how do we diagnose thalassemia? Let me tell you that if a patient is not evidently anemic, there is a very less chance that you would suspect thalassemia. That is why thalassemia without the major form of a disease is usually diagnosed when the patient undergoes tests for some other disease. So let us see how to diagnose thalassemia. Severe forms are usually diagnosed in childhood by blood tests. The others are diagnosed accidentally as a part of screening for other disorders. Patients who do not respond to iron therapy for anemia during pregnancy are also accidentally detected when they are tested for hemoglobinopathies. Those who have a family history obviously are tested very early in their life. Thalassemia traits are common in Mediterranean countries such as Greece, Turkey, Asia, Africa and Middle East, and hence screening programs are very common in these countries. Pre-genetic testing is done before the baby is born. The test is done in the embryo or the fetus via chorionic villus sampling at 9 to 11 weeks or amniocentesis at 16 weeks. This is done when either or both of the parents already have been diagnosed by some form of thalassemia. The diagnosis is done by complete blood picture, special hemoglobin tests such as high performance liquid chromatography, hemoglobin electrophoresis, and genetic testing. Now that we know how to diagnose thalassemia, let's see and talk about the treatment options. The main crux for the treatment of thalassemias is the presence of a hematologist, chelation therapy and blood transfusions. The type of treatment depends upon the type of thalassemia. The more the severe, the less hemoglobin and hence the body has severe anemia. People with thalassemia major usually require regular blood transfusions. People with thalassemia intermediate, which is not so severe as major, but may require occasional transfusions, especially when they fall ill or they have some infection. People with minor or traits do not need transfusions and usually have only milder forms of anemia. These patients are also supplemented with vitamin B12 and folic acid. Regular vaccinations are provided to these patients because due to the overactivity of the spleen, they become immunocompromised. Now, stem cell transplants also play a major role in many of the developed countries in treating thalassemia. Chelation therapy. Chelation therapy is not a therapy per se for thalassemia, but because of the side effects of blood transfusions these patients usually require chelation therapy. Thalassemia major patients, due to repeated blood transfusions, have an increased risk of iron overload. The iron builds up and gets deposited in organs of heart, liver, and brain. To remove these excess deposited iron, chelation therapy is given to these patients. These patients are also advised to have good nutrition and to avoid excess of oral iron. There are many non-governmental organizations in India and the world who support thalassemia patients. The most oldest of it all is one which is established in 1968, that is called Thalassemia India. They are mainly aimed to provide information, treatment to patients, family and doctors throughout India. The link is given below. You can contact if you know any patient who is suffering from thalassemia. Please share this video with them. Me as a gynecologist would like to make a particular point here that we cannot eradicate the disease, but we can always prevent the disease from emerging, especially with pre-genetic testing. So when you plan your pregnancy, you must go to your gynecologist and get your hemoglobin electrophoresis done. If your hemoglobin electrophoresis is normal, then there is a very good chance that your baby will not be a trait or a minor. But if your electrophoresis says that you are a minor or a trait, then you must get an electrophoresis done for your partner also. Because if both of you have got minor, trait or intermediate, then the baby may have a major form of the disease. So I would always suggest a prenatal checkup with your gynecologist before planning your pregnancy. I hope this video was useful. Please share it to all the patients who you think need to know about thalassemia. Thank you.